everyone's looking for some glimmer of hope, and the one very interesting data compiled by the India Today Data Intelligence Unit is the rate of growth of the virus in India. And I'll show you on our screen right now, if you compare across some of the biggest countries that are hotbeds of the coronavirus, the number of days it took to go from 100 cases to 1,000, India actually is the second slowest. In Turkey, it took 4 days to go from 100 cases to 1,000. In China, it took 5 days. In Iran, it took 5 days. In Japan, it took more time than it did in India, almost double the time that it took in India. But in South Korea, it took just 6 days. In Italy, 6 days. In Ecuador, 6 days. So it happened in less than. It is to ask the question, is the virus spreading slower in India or not? But the counter question to that is, are we testing enough to know the truth? In India, it took 14 days to go from 100 to 1,000. Apart from this, there's also a new study that's come out which looks at TB vaccination, which all of us get, the very painful injection you get when you're a child. Now, it turns out that in countries where that BCG vaccine had been given when children were young, those countries are showing greater resistance and fewer cases of the coronavirus. Now remember, it's a live epidemic, so all the research is still in its preliminary stages. Shravasti now files this report on how India is seeing some glimmer of hope. It still needs to come together. It could get much worse still, but at this moment, there is hope that we can cling on to.
A week into the 21-day lockdown, the number of coronavirus cases has crossed the 1,000 mark. India is now among the 44 countries in the world where the number of COVID-19 cases are above 1,000.
देश में 1251 कंफर्म केसेस आए हैं और टोटल 32 डेथ्स रिपोर्ट हुई हैं। पिछले 24 घंटों में 227 नए कंफर्म केसेस और 3 नई डेथ्स रिपोर्ट हुई हैं।
India Today Data Intelligence Unit scanned daily situation reports on coronavirus published by the World Health Organization to find how India compares with other countries in the fight against COVID-19. The DIU divided the data into 3 categories on the basis of days taken for coronavirus cases to jump from 100 to 1,000. Category 1, less than a week. 6 countries reached 1,000 cases in less than a week: Turkey, China, Iran, South Korea, Italy and Ecuador. In second category comes nations that jumped from 100 to 1,000 in 7 to 10 days. These include France and Germany. 13 countries reached 1,000 cases in 9 days, including Spain, the US, the UK, Canada, Malaysia and Sweden reached 1,000 cases in 10 days.
Interestingly, we also found that the countries where it took more than 10 days for coronavirus cases to jump from 100 to 1,000, barring Australia, all the countries had recorded a low number of confirmed coronavirus cases. In our analysis, we found that there were 12 countries where the jump happened in more than 10 days, and of them, almost 60% countries had below 1,500 confirmed cases of coronavirus. And interestingly, most of these countries have already announced a complete lockdown of their territories to avoid the pandemic from spreading further.
The third category took more than 10 days. There were a total of 12 countries, which include Japan, India, Greece and Iceland. Of them, India took 15 days. Interestingly, most of these countries had announced a complete national lockdown relatively earlier than the countries where the virus is on the rampage. A study by the MIT has also revealed that summer may slow down the spread of the virus. While India has managed to slow down the surge of the virus, the question remains if we will be able to flatten the curve or will India see a spike. With Nikhil Rampal in Delhi, Bureau Report, India Today.
So can India flatten the curve? Are there factors outside of human control which make India ideal for a less virulent blow of COVID-19? Joining us on this broadcast, Dr. Nageshwar Reddy is the chairperson of AIG Hospitals. Dr. Deepak Natarajan is a public health consultant. Dr. Nageshwar Reddy, I come to you first. You've given an interview which is being tracked widely where you say there is no reason to panic and COVID-19 is something that we can conquer very easily. Can you list out at the outset why you believe that India will not have to deal with a very severe blow, that what happened in America, what's happening in Spain and Italy will not happen in India? What gives you that confidence?
Well, thank you, Rahul, for having me on your show. I am very optimistic, and I think this is important to convey to all our citizens that we are not in a hopeless situation. If you look at the infectivity and the fatality from a virus, there are two factors that determine this. One is the virus itself, and second, of course, is the body's immunity. There are several other external factors like when lockdown was introduced and so on. Now, if you look at the virus itself, there have been several studies where the genome of this virus has been studied. In fact, the National Institute of Virology did the first studies from the first genomes that were available from Kerala from this virus, and it's put out in the International Genomic File. When compared with 5 other countries which also put this up, like United States, Netherlands, Japan, China, and so on, there was a slight difference. Now, what this difference make, whether they really help to decrease the virulence of the virus, we're not sure. But fortunately, the mutation that occurred in the gene, the strain that was seen in India was the spike protein which attaches to the body. Again, these data do not suggest that we have a less virulent strain, and also there's increased mutation of this virus going on. So we have different mutations coming in all the time. But there is definite genomic differences between different viruses. The second important thing is the immunity. And like you mentioned, that BCG article that has just come, also again not verified, there seems to be different protective mechanisms against this virus. And very interestingly, in the ACE2 receptors, especially in the African population, there is a difference that occurs, and maybe the virus is not attacking there. There's a large consortium of scientists in the world who have come together who are looking at the host DNA to see if there's a difference in different proteins that is actually protecting each other. Now, why I'm talking about this is that if you look at the curve patterns in India that you just saw, we definitely are in the slow curve. And you can also see that in spite of the fact that we're not testing so much, even if you add the number of cases as 10 times what you're seeing now, we have 0.9 per million, whereas the United States had 562 per million. Italy has 1,000 per million. So taking our population into account, the number of cases we have is extremely small, 0.9. Of course, part of this could be because of effective government regulations, the early lockdown we had, but I think part of it is beyond these factors, something that we have to work on.
Dr. Deepak Natarajan, do you agree with the good doctor when he says that India may not have to deal with severe consequences, and there are various factors, some of it to do with government action, some of it just to do with providence, that India may not have to deal with the full onslaught of coronavirus?
No, this is a huge problem for the world, and we also will have to tackle this. It is not that simple. We should not overestimate the problem. At the same time, we should not underestimate it also. All right? Now, the biggest factor right now, which suggests the lower prevalence of this disease in India, is the fact that we have higher temperatures. Dr. Reddy has already mentioned, or probably one of your correspondents has mentioned, the MIT data, which suggests that at temperatures above 17 degrees Celsius, the virus is not so active, right? And in India, right now we have a temperature of definitely above 25, almost hitting 30. So maybe that is the reason why the virus is not so active. And of course, the measures taken by the government do seem to be working now, as has been seen everywhere.
The point elsewhere,
there have been no
that even if there are about 20,000 deaths in about 6 months, it would not have been worth crippling the economy. So you're essentially saying that maybe there is actually no reason to panic and we've got the situation reasonably under control, Dr. Natarajan?
No, we shouldn't panic. Panic is not the right word. I mean, we should ensure that the public is informed that there is a disease, there is a new virus, and this can be tackled. It is not so ferocious. 80% of people affected are having mild symptoms or no symptoms. Only 15% are serious, and just about 5% hit the ICUs. So the most important message that should go back to the public and to your audience is that this virus is manageable.
Now, Dr. Reddy, the other point that you make is about that MIT study, and I want to just pull it out on our screen. Essentially, what that study done by the Massachusetts Institute of Technology, and remember why this isn't the last word, is because it's still a live virus, and therefore the situation could change. But the point that it makes essentially this is by a scientist by the name of Qasim Bukhari. He makes the point that in countries where the temperature is above 18 degrees Celsius and the humidity levels are high, there are only 6% of Corona-19 cases that have been reported, and the BCG study as well. But my concern, Dr. Reddy, is that a lot of this is still, in its infancy. The research is not peer-reviewed, it's not authenticated, it's not out in Lancet, it's just very, very initial. So we can't look at any of this and sit back, get complacent. But why is it that that BCG study gives you some hope that if you've got this, why do you think that's happening? That if you've got that tuberculosis vaccination, those countries are seeing lesser impact of Corona-19 than in countries where that TB vaccine is not compulsory.
So Rahul, I think as you rightly said, we should not look at one study and say that we have solved the problem. This MIT study is very interesting, where they clearly showed that if you look at the temperature patterns versus the curves in different countries, definitely there was a difference in terms of temperature and also humidity. Humidity also is very important. So we of course have to still work more on this and see if this really happens. And of course we'll know by April or May whether this is really affecting us. But what is important to remember is temperature. What we see outside is different from internal temperature, what you see in the rooms, because we have air conditioning, we have so on, and the other things. But what I'd like to again reinstate is what Dr. Natarajan has said. It's very important to convey to the people that there's no need to panic. Things are under control. There should not be any major issue. Now coming to the BCG, this BCG study was also more like a modeling study that was based upon the fact that in areas where BCG was given, this virus is less. So there may be co-founding factors also, like immunity in these areas, exposure to other viruses, and so on. So it's a little complicated. We'll have to study all these factors, but certainly there's hope coming from these two studies.
Whether it's temperature, whether it's humidity, whether it's the presence of other viruses, all of it together sounds like a mess. But in this case, it could just keep us healthy and strong. That's the hope, and just the providence of the fact that we've got the TB vaccine when we did as a country. For the time being, Dr. Nageshwar Reddy, Deepak Natarajan for joining us. Thank you very much.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.